It's Thursday night, it's 6:30 and it's a fireside chat, and I'm talking today about itchy skin, dry skin. I'm just trying to print, let's start to it now. Why we get dry mucous membranes, and what basically we can do about it. So I have written, and my printer's now run out of paper, so just fill that up. So I have done a bit of research this afternoon and pulled together some things. So we're going to cover dry eyes, changes in the mouth, the skin. We're going to talk about lichen sclerosis as well as dry mucous membrane, sort of generally and all over. So I've got, and I'll put a link in about the lichen sclerosis in the chat afterwards, just so you can have a read of it and learn what it is, so you know what to look for. So that is really important because we need to sort of look after everywhere. So we're going to talk about what causes the itch and why it causes it, or the dry mucous membranes, and what we can do about trying to improve it. So as always, I've had a chat with Louise today, so Louise Newson, and I've pulled up my notes from the Confidence in Menopause course I'm doing, because like I said, I did a module on skincare, on skin the other day. So there's quite a lot to cover, but so I'm not going to go into a lot of depth. We're just going to sort of basically say why we have the changes and what we can do about managing it. So if you're here, say hi where you are. If you're not, if you watch on replay, do hashtag replay, and as always, please put comments in the comments, put questions in the comments. If you don't want everyone to see your question, add it into send me a DM or post anonymously. I've got my phone open, so hopefully if you put comments in, I can read them on the phone, because they don't always show up on the laptop. So I'll just get a quick slurp because my mouth is really dry. So welcome. So itchy, dry skin, it's not sort of an exciting topic, but it does affect a lot of people. And the Edinburgh Royal Infirmary Menopause Clinic did a little bit of research, and they said that 40% of patients were complaining of dry skin, and of those, 44% thought HRT did improve it. So if you're on HRT with itchy skin, have a think about it. Has it improved it? So besides skin, I'm going to talk about other areas as well, because we've got mucous membranes and damp areas all over. I'm not going to go into joints today. Joints does have they're synovial joints. They have a synovial fluid in them, which is really thick. Imagine it looking, it's like a very sort of runny honey, quite thick, and that's what helps keeps the joints apart and smooth and nice and smooth, and keeps them moving. But we're not talking about that today. So right, okay. So in regards to teeth and the mouth, so estrogen supports teeth, the teeth, bone, and ligaments and mucous membranes in the mouth. So when we hit menopause or perimenopause and the estrogen levels start to drop, it can lead to gingivitis, so swelling of the redness in the gums. It can lead to gum infections, toothache, a dry mouth. I know I've got really dry mouth. Some people have burning mouth sensation. Some people suffer from tooth loss, bad breath. You can have some people have a change of the taste, especially with salt and sour based foods, and an increased in sensitivity. If you notice, if you eat an ice cream, you go. So the recommendations. So this was out of Louise's book, and this section on teeth was written by a dentist, and their recommendations to manage it with good dental hygiene. So using a powered toothbrush, so one that's got a battery in it, or an electric one, because they're more efficient at cleaning the plaque away. Using floss or those little brushes, you know, to clean between your teeth to help remove the plaque as well. Looking at your diet and reducing sugary foods. Lower, because sugary foods will lead to tooth decay, so trying to, besides the other benefits of not eating sugar, it will help reduce your risk of tooth decay and losing your teeth. Make sure you're getting your regular checkups with your dentist. Any problems, go back to them. And they suggested also possibly using, you know, if you're starting to notice sort of changes in your teeth, maybe wearing a retainer, or talking to your dentist about getting a retainer, because as you lose the collagen, your teeth can start to move. So if you've noticed a bit of any movement or changes in your teeth, make sure you speak to your dentist about maybe getting a retainer and stuff like that. So that is the tooth. And remember, you know, and to keep you know, even if you've got a dry mouth, making sure you've got a bottle with you with some water-based fluid in it. Making sure you keep hydrated, but it's also making your mouth moist. Another symptom that people complain about is dry eyes. So when we blink, the eye releases a tear film to sort of protect the cornea, which is I used to work with an ophthalmic surgeon, and I remember a colleague saying that a non-corneal surgeon called the cornea a dust cap. So the cornea is that clear section over the pupil that allows the light to go in. So keeping, you know, the cornea and the conjunctiva around it, I want to keep it needs to be damp, sort of and smooth, so when you're blinking it's not painful, it's not gritty. And when we've not got enough tear film, which is made up of some water, some oils and some mucus, and keeps the eye lubricated and all that, it can lead to dry eyes, stinging eyes, or a feeling of grit, like you've got something in your eye. Or it can actually, if your eye's quite very dry, it can actually lead to blurred vision, because it's the cornea is sort of shriveling up, and we need the cornea nice and smooth and well hydrated to allow the light to come into the eye so we can see. So unfortunately, as estrogen reduces and testosterone, this reduces the amount of tear production fluid that is made, so you're more likely to get dry eyes. So if you're struggling with dry eyes, have a chat with your if you're seeing an ophthalmologist or ophthalmologist, they can check your eyes to see if they're actually dry, or with your optometrist or optician. One way of I know a few years ago I was told that my eyes were dry, but the glands were blocked as well, so I was advised to put on warm heat. So cotton wool, it's sort of that had been put in warm water to try and loosen it and let it out. So getting sort of speaking to your optometrist or optician about sort of eye drops and things like that can help as well. So recommendations was to limit screen time, because the screen dries out our skin. So making sure we do that is really important to keep your eyes sort of moist. Protecting the eyes, and especially in cold weather, walking outside in the cold and the wind, that can make the eyes, the tear film evaporate because of the water in it. So they suggested using wraparound glasses. And if you use contact lenses, consider reducing the number of days that you're using it, so you can keep the eye sort of hydrated. The other thing they suggested is find a trigger for your dry eyes. Is it going into a certain type of environment? Is it if you're going somewhere really smoky, you know, what is called, you know, is there a trigger? So keeping a track of it. They suggested using a humidifier, because that's a dehumidifier, and especially that would be really good, you know, in the winter when we've got the heating on and the fire on and the central heating, and you're drying up, so getting a dehumidifier. I know you can get electric ones, you can also get little ones, I've seen pottery ones you can hang on the radiator, you just put water in. So I have on my Amazon wish list and never actually bought. And I was writing this up today and I was thinking I really do need to do that, because I've noticed my eyes are getting quite dry. Looking at your diet, making sure you're eating omega-3s, so oily fish, eggs and dairy, because that omega-3 helps with the production of tear film. So there's a few things, so we can, because we need to be able to see. So that's the eyes and the teeth and the mouth. So skin, itchy skin. A lot of people, some people describe it as, I was going to say snakes, spiders crawling along the skin. So estrogen has receptors, and if you remember back to biology lessons at school, that little, that diagram of the skin, there's so many layers to the skin. I can't remember, is there about 7? And estrogen has receptors in every layer of the skin. So obviously when the level of estrogen drops, then we start to see the changes in skin. Production of ceramides that binds the skin layers together, that helps reduce evaporation, that reduces. Estrogen also stimulates the sebum, which is like a mucus, and that helps prevent dehydration. So when we have less estrogen, we don't have the same amount of sebum, so where skin is more likely to dehydrate and become dry. And when it's dry, it becomes more itchy. I want to start scratching now because I've said that. And also the dry skin can trigger eczema as well. The skin also becomes thinner as it loses more water, it becomes drier, it becomes itchier, and the lines are more evident. And I know I look at my hands and I can see my mum or my grandma in them. The skin is the largest organ in the body. I mean, we've got a lot of it. And estrogen helps produce ceramide, so they're the oils, the lipids that help the integrity of the skin and keep out irritants. It also helps produce natural hyaluronic acid that lives just below the surface of the skin, and that helps the skin to retain the water to keep it hydrated. It helps production of the sebum in the glands, the oily substance that forms a barrier to protect and moisturize the skin. So if you have a reduced amount of sebum, the skin becomes very dry. If you have an increased amount of sebum, it becomes oily and the pores clog, and that's where you can get the spots. So if you remember back to teenage years, going through puberty, you have an increase of really oily skin, and that's where you get the spots from. Estrogen also helps produce collagen, and that's a protein that supports the skin, and apparently is 98% of the skin's weight. And we lose about 30% in the first 5 years of menopause, and then we lose 30% of it. So that's like a third of the collagen within a few years of menopause, and then we're losing 1 to 2% a year. As the estrogen reduces, the skin becomes more supple, less supple, and it becomes thinner. There's less blood flow to the upper layers of the skin, so increased, and we're losing more water, so it becomes less hydrated. The skin loses elastin, and that helps with the stretchiness. So how can we help improve it? And also, as the skin gets thinner, you notice, and drier, you notice more and more lines. So HRT can apparently help the quality of the skin, but if you don't go on HRT straight away, apparently if you've lost the collagen, it will not help you replace the collagen. It might slow down the future loss, but it won't replace what you've lost. So the dermatologist that did the seminar that I did in the course, and has written in the book, recommending avoiding soaps that lather, foam and bubble, because they're the ones that strip away the grease. I mean, I've spoken to this about this before. sulfates in products. If you read the ingredients of those face products, your shower gels, your toothpastes, sodium lauryl sulfates, you'll find them in washing up liquid, and you'll find them in shampoo, you'll find them in shower gels, you'll find them in soaps, cleansers. So trying to avoid those types, because they basically strip all the oil off the surface. And if you think about it, yeah, that's good if you're washing up liquid, because you don't want a greasy dish. But you don't really want it for your hair and your skin. So looking for non-foaming gentle cleansers, and then using a moisturizer twice a day, a light one in the day and a heavier one at night. Personally, I just use coconut oil. I use it to wash my skin, and I have to say it's just a baby's bum. It has its own healing properties, with it being a natural oil, so it helps sort of with redness, and it also moisturizes as well. And because it's oily, it's keeping it in, rather than it's not water based, which products that are water based will evaporate. That's why you get dry hands. You put your hand cream on, and then 10 minutes later your hands are dry because the water's evaporated and the moisture's gone. So find a really good oil based moisturizer. Itchy skin could also be due to an increase of histamines in the skin, and it can also be triggered by iron and ferritin and thyroid deficiency. So if you've tried everything, if you've tried your moisturisers and nothing's working, it might be worth speaking to the GP about getting some blood tests to check on your iron and your thyroid levels to make sure that's not the cause for the itching. Right. Okay, so let us continue. I stopped writing notes and thought I'll just sort of go through the book. So where was it? I'm looking at the wrong place. Right, okay. Okay, so red and flushing. So this is again a recognised symptom of menopause. It can occur with rosacea, which is a type of acne, a condition that sort of the blood vessels in the skin become very red. They become this blood vessels in the skin become very reactive, so you get a redness sort of around the cheek area. And it happens especially it's very common in women, especially during the menopause. So redness and flushing can improve with lifestyle changes like cutting back on alcohol, caffeine, spicy foods, and making sure you protect your skin in the sun. There can be, you can speak to your doctor about other sort of medical options as well, and maybe laser treatments and stuff like that. Having breakouts as well. Many women will have had acne as teenagers, and it flares up around menopause as well, but they're not sure why. They think it could be that the ratio between estrogen and testosterone is linked, and that may trigger it. But again, if you're on HRT, some people may even continue struggling once they're on HRT as well, unfortunately. So suggestions are: look at your makeup, look at your products, make sure they're suitable for your skin. Check expiry dates, and sun cream should only be used for about 12 months once they've opened. And again, use a mild cleanser that contains salicylic acid to help exfoliate the skin, unblock the pores. And active ingredients like retinol, niacinamide are useful in the skin regime if you're prone to outbreaks. But it can take a couple of months for any products to work to try and reduce any outbreaks. Right. So bruising, fragile skin, slow wound healing. Yes, as I said, as we get older, we're losing the collagen, we're losing the estrogen, the skin is getting thinner, so it gets more fragile. And yeah, bruising can increase. And I know, sort of, if you think about some elderly patients, I mean, when I worked on the wards and in theatre with the very elderly patients, their skin was literally like tissue paper, and it would if you held it too hard, or you moved them without, they were being dragged rather than lifted, you could actually rip the skin. And that is because we've lost all that collagen and all that, the estrogen. So bruising is called, so the collagen is making the skin weaker, and bruising is also caused by a lack of collagen around that used to protect the tiny blood vessels. So even the slightest knock can cause a bruise, and wounds will take longer to heal if you have got lower estrogen. So I mean, that's really interesting, because I've noticed I keep looking at my legs and finding bruises I didn't know, I don't know where I bumped them. So that's obviously why. Changes in the facial appearance as well. This can happen apparently. We lose bone density in the jaw, which is why we get the sagginess in this around the chin area and stuff like that. The bones become smaller, and as the bones become smaller, we're losing the collagen. Everything starts to hang, and we get the wrinkles and all that. I mean, if you wanted, that is where you could go and have some injectables of whatever. But if you go down that route, making sure you're going to someone who is properly trained and not just got a certificate off a cornflake packet, go to someone who, check their credentials, their insurance, because if they're injecting something into your body, you might need to make sure that they know what they're talking about. So try and find someone that's medically trained. I know quite a lot of nurses tend to do aesthetics, some dermatologists do them, some ENT surgeons do them, and they've got the place. I don't think at the moment I can't see myself going down that route, but there is a place for them if it's needed. We taught the session I did on the skin session. The dermatologists were saying they were asked to look at a product labelled for menopause. This is like the menopause washing I was talking about a few weeks ago. To look at it, to see if it would work for menopause, and they said a lot of the claims weren't rubbish. But here it's got here. Look at the product's ingredients rather than the branding, to make sure what you're putting on your skin is actually what you need and not what you're being told you need. I'm not going to do that today. I might do that and look at the hair loss. Okay, so 2/3 of 64% of a survey said they had dry skin, 50% cited itchy skin, and 30% had developed spots or acne, and 22% reported that crawling sensation I was talking about, like spiders crawling up and down your legs. And when hair, people have bought sorts of things for hair. So that is the skin and the teeth and the eyes. So let's talk about just want to make sure I'm looking at the right page, because I don't want to give you information that's not appropriate for the topic that I am talking about. Okay, so talking about please hold. Right, okay. So dry vaginas, that's where they get again, the estrogen, it's not being produced as much, so all the mucous membranes start drying up. So again, it's really important, if you've got an issue there, that you can do something about getting some treatment to help it. You can buy, in the UK, you can buy over-the-counter localised estrogen. I think it's called Gina, and you can buy that over the counter. And that will just give you estrogen in that area. It's not going to go around the whole body. And they're called, and it can be sort of debilitating if you're struggling with a dry vagina. It can be painful. You might not be able to wear jeans. It might be painful to sit down. So yeah, I mean, don't suffer with it. Go and get some help. So there's different, according to Louise's book, there's different types of estrogen that you can use that can absorb directly. So the most common is an pessary. It's a tablet that you insert using the applicator. They insert it at night, so it stays in place several hours, and it's use it a couple of times a week, depending on what the advices you've been given. So there's pessaries you can use. There's creams, again, that you can insert sort of directly, depending. Make sure you're reading the instructions of how often you can use it. Some of the creams you can use around the whole sort of external area as well. There's also a ring that you can insert that will then release the estrogen over a slow period of time. So since September 22, postmenopausal women have been able to buy vaginal estrogen tablets called Gina without the need for prescription. There were several exclusions for people that can do access Gina. So when she wrote this book, this is the first edition. This is about 12-18 months old, I think. Let me just check. 2023. Only postmenopausal women aged 50 and over who'd not had a period for a year were able to buy it. So it may well have changed in the meantime. So if you're looking at going and getting some, have a chat with the pharmacist. It said, while the Medicines Watchdog, the Medicines and Healthcare Products Regulatory Agency, stressed the risk of side effects from this hormonal treatment is very low, some people may require a prescription. So if you've had breast, endometrial or ovarian cancer, blood clots, heart disease or liver disease or stroke, you may well need a prescription. People with a history of endometriosis can buy Gina if they've previously had a prescription for vaginal estrogen and have had no recent symptoms of the condition, so no more endometriosis symptoms. And women already taking systemic HRT, so systemic is like the patches, the oral, the one that goes all around the body, can only buy Gina if they've previously had a similar vaginal estrogen and the GP has confirmed it will be good for them. So, I mean, with if you go through cancer treatment as well, that you may find that you get, you know, dry vaginas and stuff like that because of, you know, especially if you've had radiotherapy or chemotherapy and stuff like that. So speaking to the oncologist about, you know, how you can better manage it, you know, is, you know, really, really important, because like I say, you shouldn't be in pain or uncomfortable, you know, and speak to your partner as well. If it's painful, just you know, explain to them why you're sort of avoiding them and stuff like that, because otherwise you're going to have issues in relationships, and then you've got another can of worms all over the floor. Right, on that happy note, I'm just going to make some awareness about lichen sclerosis. Now, this is an inflammatory skin condition that primarily affects the vulva in women and the foreskins in men. It can also affect other parts of the body, like the anus, the breasts, and the torso. Very little research been done into this. However, factors, they think it's an autoimmune, so it's the immune system attacking the body. Or possibly hormones or genetics could be involved, but they don't know because there's not much research into it. It's not been confirmed if it's hereditary. However, they said some research shows that it does tend to run in families. So it's widely believed to be postmenopausal. However, it can happen prior to that, and some children can be diagnosed with it. So it's not just something that's going to happen postmenopausal. The majority of sufferers support an inability to have sexual intercourse with the partners due to tearing, splitting, bleeding, and extreme burning sensations during intercourse. This is because the skin of the vulva and around the vagina becomes really, really thin, and the vagina opening shrinks due to the atrophy, so the thinning and scarring. Many ladies will report the loss of the labia minora, so the inner lips, and the clitoris becomes buried under the skin because of the result of tearing and splitting in the area during intercourse when they've been, or wiping themselves after you've been to the toilet. With lichen sclerosis, there's a higher risk of vulval cancer, and which is estimated about 5%, but it could be a lot higher than that due to the lack of knowledge from the medical professionals, because it is misdiagnosed as thrush. Patients that are left untreated for years automatically become higher. The risk automatically becomes higher due to the lack of steroid treatment, which has been proven in a study in Australia to help prevent cancer developing. So if you notice something is not right down there, you need to go and speak to your doctor as soon as possible, or go and speak to them. You can't get to see your GP in the UK, go and speak to the practice nurse, because they'll can have a look for you, and if you're worried, they can go and speak to the doctor. So things to be looking out for are itching, burning, any splitting or tearing, any white patches, or noticing your clitoris is getting buried under the skin, or your labias are fusing, or the vaginal opening is shrinking. And also painful intercourse. And it can be treated with steroid ointment or creams. So it is important that if you feel there's something not going on there that should be going on, make sure that you go and get it checked out sooner rather than later, because, like I say, of the risk of it turning into cancer. So I will put up a link. I'll just copy it now, because otherwise I'll forget. So you can go and have a read of it. It's quite a good website. So it's making people aware of the signs, the treatment, and they cover, there's an overview of lichen sclerosis, which is what I've just read to you, in sort of women and also in men and in children, diagnosis, treatment, what happens, a biopsy, the vulval biopsy results explained. Then they also explain vulval lichen planus and erosive lichen planus. What can be expected after vulval cancer treatment, research fund, linked to charities, and they've got information, 5 gynecological cancers, and other links and blogs and stuff like that, and awareness videos and stuff like that. So it's a really good website to have a look at. Make sure, and they've got a campaign, Know Your Vulva campaign going. So if you want to have a look at that, and make sure that you're okay, or if you're worried about anything, go and have a look at that and go and speak to your doctor. So that is itchy, dry skin. Let us know if you've got any questions. As always, if you watch it on replay, do put #replay in. That way, and if you've got any comments, again, if you can let me know, you put them in the type them in the comment section. And like I say, I want to make sure that I'm giving you the information that you need. I mean, there's so many symptoms with menopause, and if you can try and manage a few of them to make them more manageable, it will help with your overall well-being, which is really, really important, because we don't really want to have to struggle through this phase of life, when you can think of all the positives, like you're not having to buy sanitary ware and stuff like that, and etc, etc. So that's it for tonight. Next Thursday will be the last night of the masterclass. So stress and sleep and menopause, what menopause is, talking about the hormones. So we'll go into the hormones. Like I say, I've got some new pictures to prove. I've just got to put them on the PowerPoint that I borrowed from Louise Newsom to show what the extent that the estrogen has on the body, and testosterone and progesterone, so you can really get a really good idea of where they do their work, and it makes sense of why we get these symptoms. And then looking at cortisol and trying to reduce that, how we're going to reduce that, because that's going to make us feel better. And if we're feeling better, everything's much better. Relationships are much better. Attendance in work is better. Productivity is better. Motivation is better. Symptoms will be better, because remember, the worse you stress are, the worse your symptoms will be. Again, with sleep, what it is, why we need it, and how to make it better. Because again, if we're stressed, we won't sleep, but if we're not sleeping, we get stressed. So we're trying to put down the foundations of getting on top of our menopause symptoms, with understanding what's going on, so we can better advocate for ourselves, and we don't worry about things, and we can go and stand up and go and ask for what we want and what we need. Again, the foundation of understanding the cortisol and how we can manage it, and the foundation of managing our sleep and having a good routine to help with well-being. So all the foundations for health and well-being next week. So Tuesday 7 p.m, Wednesday 7 p.m, Thursday 7 p.m, approximately an hour each night, might not reach to an hour. We will have a Q&A as well, so at the end of it you can ask questions. So if you've not registered, please register. I'd love to see some of you there, and if you can try and come live on the Tuesday, Wednesday, Thursday, you can interact, you can ask the questions there and then. Whereas if you're watching it on replay, you'll think, oh yeah, I'll watch it, and we don't always. We do forget. So, and and it's only going to be in the group for a couple of weeks before it goes down. So make sure you register, try and attend live, interact with me, make me happy, ask some questions, and you never know, the questions that you bring might lead me to the next lot of training. So there's that as well. And also the VIP day, again, please let me know where you want help. I did put a post up yesterday asking for people to comment. If you can comment, I'd really appreciate it. The VIP day I don't know how I'm going to do it yet. I don't know if we're going to do it over 2 days. It'll be approximately 4 hours in total. Might do a couple of hours and a couple of hours, or might do it in one hit. But I need your input, please. I want to make sure you're getting the information you want. I know you've got questions, but you're just not asking them, or you're not asking them in here. So please let me know. I want to help you, you know, and I can't help you unless you tell me what I need. I have got a couple of ideas from a couple of people from on another Facebook group. I went in and put a post up, so I'd love for you here in the group to come and tell me, even if it's I don't know what menopause is, we can cover that, you know, even if it's why have I got joint pain, or why can't I lose weight. If you can give me as much as you can, and then we can see what we can do. We can make it into a VIP day and get these questions answered. Right, okay, so I'm going to shoot off now. Have a good evening. If you catch on replay, do write #replay again. Put your comments or questions in the comments, or send me a comment, a DM with your question. If you've got any questions and you want to talk to me about anything, don't forget you're able to do that. We've got, you know, I offer the free 15-minute call, and if you register for the masterclass, you're invited to a 20-minute menopause support call, looking at where you are and where you can go to feel better. So, and that would be normally £47, so you are saving yourself some money to have that call to help you feel better. Right, I'm definitely going to go now, and I will see you all soon.